have created a language equitable program to improve patient outcomes for older adults. I did that by creating a training program for healthcare providers to assess and communicate with their patients, regardless of what language they speak, and by creating a language congruent care partner program for older adults to follow them as they go through surgery. Cognitive changes are the most common complication for older adults, and a key perioperative challenge for them is to undergo surgery and maintain their cognitive function. I had a lot of patients who were coming in and they wanted to make sure that they preserved their cognition after surgery. I started looking at the literature. Every major study in this area excluded patients that don't speak English. We looked at all of our patients who had come into the preoperative clinic. If you spoke a language other than English, you only received cognitive screening about half the time. Versus if you were English speaking, you received cognitive screening about 89% of the time. Regardless of what language you spoke, if you had an abnormal cognitive screen, you were at greater odds of developing postoperative delirium. The goal of the program is to create a language equitable way of assessing all of our patients, creating risk mitigation strategies to help preserve cognition and improve patient outcomes overall. We are working with 7 different languages right now. We are creating language and culturally appropriate education material. We are actually designing some videos that patients are going to be able to watch before their surgery to help prepare them for surgery. I developed a simulation training for our healthcare providers to teach them how to assess our patients, have discussions about risk and risk mitigation strategies in languages other than English. We pair patients with language congruent care partners that are able to follow the patients throughout the perioperative period. Patients and their caregivers love it because they feel that there is someone there who's looking out for them. If you've ever been hospitalized, you just don't feel human sometimes. The more you feel human, the more you're able to have conversations with people, the more stimulated your brain is and the less likely you are to have episodes of delirium. It builds trust with the patients, which I think is an important part of healthcare delivery. In the next 5 to 10 years, I hope that every patient, regardless of what language they speak, every older adult is having routine cognitive screening, and we all learn how to care for older adults in a way that improves outcomes. If I cannot communicate with my patients, then that means I am delivering suboptimal care. So that's why I developed this program with language equity at the forefront so that we can improve outcomes for all patients, regardless of what language they speak.